Hi everybody, my name's Mike and I want to share my story because a little more than a month ago I got sick with coronavirus. I don't have any symptoms now, but there's still some issues that going on, especially I see how medical staff reacts, and I have quite an interesting story with my lab test. So I want to discuss all of it, as well as reveal some issues and how people are trying to manipulate some of facts that we have and some evidence. So I'm gonna start with that. I had a coronavirus. Today is my 35th day of having, since I first had symptoms. I got tested on 5th of, was it 5th? 7th of, I got tested 7th of May, and it was positive. And after that I got tested in 2 weeks, it was still positive. And after that I got tested again in 2 weeks. All of those were PCR tests, and they showed that I have virus RNA in my nasal cavity. But interesting thing, I've been in close contact with my wife. We haven't been practicing any distancing because the first week is before the test, the most rigorous symptoms that I had, I was still in contact with her, so we didn't practice any distancing since I got positive test results. It was approximately a week after I had some symptoms. So she tested this week, a few days ago, she tested negative with IgG antibodies. So she never had virus in the first place, or at least she didn't have it enough to form IgG antibodies, but she was negative 4 weeks ago with her nasal swab for PCR for viral RNA. So it seems like she never got the virus from me in the first place, even though we haven't practiced any distancing, and it seems my test for some reason is still positive. I don't know why, because I haven't had any symptoms for like 4 weeks, but what I noticed in the testing site where I was, people weren't practicing the best PPEs and the best anti-epidemic precautions. For example, they were wearing suits and face shields, and the lady that was taking my last test, she was in a suit made out of some kind of cloth. So I asked her what happens if I sneeze on her, and you have to stick the thing in your nose, and she said well, that she's protected. And then I said, but how about other patients that are gonna come see you? You wouldn't be able even to wipe that virus down, so there's no way you can clean your suit, and you're gonna still be wearing it for other patients, so you can get them contaminated. And the other thing, so if somebody comes without the COVID and gets tested and gets infected by her, his test is gonna be negative, and he's gonna have symptoms, and further testing will be positive. Then we're gonna raise a question, is that COVID testing valid at all? And many people are gonna say no, and there's gonna be many issues with that, and all of that just because somebody practices imperfect, and like even far from perfect. That's pretty gross misunderstanding, misconception of how you should utilize your PPEs, and that's what I've seen. And so one of the reasons why I'm making this video, because of reaction I had from my health department in my city of Westfield. I used to be a physician back in Ukraine and moved to United States a little more than 2 years ago. I still work on ambulance. I used to work on ambulance and specialized EMS. I now work in ambulance, just like a regular EMT basic. And I have many patients who are vulnerable to virus, and I cannot go to work until I know that for sure I have no virus. But the city told me that I actually technically can go back, since I haven't had symptoms for 10 days. And I want to emphasize how ridiculous this answer is. It's not really safe, because what the nurse told me, she said that because of some new data that came out, CDC says that if you don't have any symptoms for 10 days, you don't infect people. But the question was raised, is that actually clinical data? No, it's not. Nobody tested, and I wish somebody would test my case. Somebody would come to my home and test my air and test my surfaces and let me sit in clean room and sneeze there for a few hours and then test surfaces there and test air there and actually make sure that I cannot infect someone. Nobody's gonna do that. And that's a manipulation of evidence. And they said that they have evidence that some virus particles can be present in your mucus on the nose without virus replication, and that's gross misconception. That actually means that evidence they've been using are faulty. That's how people are misusing evidence. So just to remind you, nasal mucosa, it's a cilia epithelium which gets changed. All the cells get changed a few times a week, and all the mucus gets drained from there because of that cilia. It gets drained a few times a day. So there's no way that I can host any viral particles in my body for even a day. That's just impossible. And if that would be any other virus, this is an RNA virus which doesn't have reverse transcriptase, so it doesn't have any type of, let's say, integrative persistency or something like that. So I just want to emphasize for everybody to be cautious with how, and pay more attention how you utilize your PPEs, and be very cautious on evidence that we are forced to believe in. And I don't believe this is a good evidence that we have been told, and those protocols are not really good. I'm still trying to reach out to different institutions. I have been calling and pushing mails to many people. So far I have got zero reaction for last 2 weeks. Nobody called me back or sent an email back, and even though I've tried to emphasize that there should be big changes in our decon procedures and PPEs, and I've actually came up with the suit. You can watch a video on my Facebook page that helps to resolve all the PPE issues we have at this time. Nobody's been paying attention to this, and upcoming autumn season we're gonna have really terrible issues because we're gonna have flu season, and then we're gonna have coronavirus. Is not gonna go away because it's now community acquired. And if people are gonna still keep on, medical stuff, practicing imperfect PPEs, they are gonna end up cross-contaminating people who have corona and people who have flu with each other, creating some patients that are gonna be really vulnerable and prone to death. So stay safe, everybody. Take care. I think I'm gonna remake this video because it's not the best quality, but this is the point I wanted to bring to you as soon as possible, and I'm gonna go in more details at some other time. Have a good day, everybody.